Welcome to the Stuff You Should Think About podcast, where I answer everyday questions about phenomena and objects. What's good? I'm G. A lot of people hear OCD and think it's just about someone that likes things clean and organized or done in a certain way. But real OCD is much more than that. It's not a personality trait, and it's not just being picky. It's a mental health condition that can be deeply distressing and exhausting to live with. In this episode, we'll break down what OCD is, how it works, and why it can feel so hard to stop. Even when someone knows, their fear may not make logical sense. OCD stands for obsessive-compulsive disorder. At its core, OCD usually involves two parts: obsessing and compulsions. Obsessions are unwanted, intrusive thoughts, images, or urges that create anxiety, fear, guilt, or discomfort. Compulsions are the actions, physical or mental, that a person feels driven to do in order to reduce that distress or prevent something bad from happening. And this is important. These thoughts are not enjoyable and they're not chosen. In fact, they often target the very things a person cares about most. That's part of what makes OCD so painful. The easiest way to understand OCD is to think of it as a cycle. First, an intrusive thought appears. Maybe it's, what if I'm contaminated? What if I forgot to lock the door? What if I hurt someone? What if I make a terrible mistake? Next, that thought triggers a strong emotional reaction. Fear, uncertainty, shame, disgust, or a sense that something is not right. Then comes the compulsion. The person may wash their hands, check the lock again, ask someone for reassurance, avoid a situation, or go over the thought again and again in their mind. That compulsion usually brings relief, but only for a short time. And that short-term relief teaches the brain, when you do the ritual, you feel safer. So the brain keeps sending the alarm back again. That's why OCD can feel so sticky. The compulsion helps in the moment, but it strengthens the cycle over time. One thing that can be confusing about OCD is that the person often knows, at least on some level, that their fear may be exaggerated or unlikely. But OCD is not a simple logic problem. It's more like the brain is misfiring an alarm and insisting that uncertainty is dangerous. Most people have weird or disturbing thoughts sometimes. That's part of being human. The difference with OCD is that the brain assigns too much meaning to the thought. Instead of letting it pass, OCD says, what if this thought means something? What if you're responsible? What if you can't take the risk? What if you need to be completely sure? And that search for certainty can become endless because OCD rarely accepts reassurance for long. When people picture OCD, they often imagine visual behaviors like hand washing or checking. And yes, those can absolutely be a part of it. But compulsions are not always obvious. Some compulsions are external, like washing, checking, arranging, repeating actions, avoiding certain people, places, or objects. Others happen internally, like replaying memories, mentally reviewing what happened, silently repeating words or phrases, trying to replace a bad thought with a good one. seeking certainty in your own mind over and over. That means someone can be struggling with OCD even if no one around them realizes it. The good news is that OCD is treatable. One of the most effective treatments is called exposure and response prevention, or ERP. ERP helps people gradually face thoughts, situations, or feelings that trigger OCD, while resisting the urge to do the compulsion. At first, that can sound scary. But the goal is not to force someone into distress. The goal is to help the brain learn a new lesson. That anxiety can rise and then come back down on its own without the ritual. Over time, that weakens the OCD cycle. Some people also benefit from medication, especially certain antidepressants called SSRIs. And for many people, treatment is not about never having an intrusive thought again. It's about changing how they respond to it so that the thought no longer runs their life. If any of this sounds familiar, it's worth knowing this. Having OCD does not mean you're broken, dangerous, or alone. OCD can be incredibly overwhelming, but it is treatable, and people do get better with the right support. If you think you may be dealing with OCD, reaching out to a licensed mental health professional, especially someone trained in OCD treatment, can be a strong first step. Thanks for listening. This episode is for educational purposes only and is not a substitute for professional medical or mental health advice.